Good day and welcome to today's webinar, Transforming the Patient Billing Paradigm with Payer and Provider Collaboration. My name is Chris Keller and I'll be your host. The webinar begins now. Presented by Seth Cohen, co-founder and co-CEO of OODA Health, along with Rich Roth, Chief Strategic Innovation Officer at CommonSpirit. In this webinar, Seth and Rich will be talking about the innovative partnerships between OODA Health, CommonSpirit, and early payer partners, including Blue Shield California and Blue Cross Blue Shield of Arizona, as they collectively worked to improve the patient billing experience and revenue collections while reducing administrative friction. We have a sizable audience of payers, providers, and consultants joining us today, and we're grateful for your interest. Today's webinar is being recorded, and within 48 hours, we will send out a link to an on-demand recording, transcripts, and the slides. We'll also be taking questions at the end of today's presentation. You can submit your questions using the questions panel at the bottom of your Zoom controls. Joining me to moderate questions is Andrew Pagella. To keep today's presentation lively and engaging, we also want your feedback. At the midpoint of Seth and Rich's presentation, we have 3 poll questions that we'll ask you to weigh in on. Those questions will show up in the middle of your Zoom screen, after which we will also share the results. And with that, let me turn the time over to Seth Cohen to begin. Seth.
Thank you. Good morning or good afternoon. Appreciate you joining us for this great conversation. I'm delighted to have with me Rich Roth, the Chief Strategic Innovation Officer at CommonSpirit. I'll actually advance to our presenter slide here. So thank you, Rich, so much for joining us. I really appreciate the partnership. And as Chris noted again, I'm Seth Cohen, co-founder and co-CEO, joining you from my basement in San Francisco. So in terms of what we want to cover today, we're really excited to talk about how we are changing the patient billing paradigm through payer and provider collaboration. And to do so, we're going to talk a little bit about how did this all come together. We're really delighted and proud that CommonSpirit was in many ways a founding partner to OODA. And so when we first talked to them about our vision, what led to that, what contributed to those ideas, and how did we bring health plans to the table to help address some of the patient billing issues that we all face. Then talk a little bit about what was the market challenge we were looking to solve together, the particular problem to solve, and then how has it gone? What did the implementation look like, and what have the results been like to date? So really excited to dig into these areas in particular, share with you the increased collections we've been able to deliver to CommonSpirit, reduce friction with key payer partners, and last but certainly not least, how do we improve the patient billing experience? So that's what's on the docket for today. I'm going to turn it over to Rich to share a little bit more about CommonSpirit.
Thanks, Seth. It's great to be here, and it's great to dialogue on this really important topic to our patients and our communities. For those of you that don't know CommonSpirit, we're a newly formed system that was a merger between 2 entities that now comprise more than 4,000 sites of care across 140 hospitals in 21 states. We're now the largest not-for-profit healthcare system in the country. And ultimately, we try to differentiate ourselves in a couple things. One is a spouse commitment health equity. And that includes, being one of the largest providers to the poor and the underserved across this country. And secondly is a commitment to partnership. And that commitment to partnership and collaboration speaks to work that we do not only with entrepreneurial companies, with other companies outside of healthcare, large and small, but also with our payer partners, with pharmaceutical companies and other partners across the ecosystem. And so ultimately, we believe collaboration is the secret sauce to effective and coordinated care. And we're happy to talk a little bit today about the partnership that we've been doing with OODA, which is now in our Arizona and California divisions, together with some of our payer partners, with really the goal to improve the experience for our patients as it relates to the financial part of their care journey. Seth, would you mind?
Yeah.
Thank you. I thought I'd start with a little bit of a story. When I started my career in healthcare, it actually was in the patient financial services area right out of college. So billing, credit, collections. I was the person that received calls from patients after their procedures or surgeries or visits and kind of were confused and scared sometimes. I mean, didn't my insurance cover this bill? How expensive is this? What is a copay? What is a deductible? Can I bill my spouse's insurance in addition to mine? I'm not sure I can afford this. Just a ton of stress and anxiety in, those calls. And that really helped me to understand what an important part of the care journey it is for patients. At that time when I worked for, a hospital early in my career, I can't say we viewed the insurance providers as partners. We kind of felt that we were fighting on behalf of the patient to get, payments for their care. It was almost an antagonistic relationship. And, as I came to mature in my career and learn more, I also viewed that, if you're looking at the insurance side, equally talented and caring people trying to get the coverage for their members. And often that relationship with the hospital was kind of constrained and, possibly because there were just a lot of administrative inefficiencies and operational challenges in this billing process that, resulted in friction in both sides. And so, at the heart of this, we kind of said, working with the OODA team, what if we actually came together with a few payers, in this case, Blue Shield, Blue Cross of Arizona, and Blue Shield of California, and actually thought about, can we reinvent this experience so that it works for patients and it works for, the people that do the work behind the scenes for payers and providers. And really, that was the beginning of our journey that Seth will talk a little bit more about.
Yeah, that's awesome. Thanks, Rich. And so on that point, let me just say a little bit about OODA. Now that you've learned a little bit about our provider and payer partners. So who is OODA? So first of all, we get the question a lot. What is the name OODA? Where does that come from? OODA is an acronym, and it's represented by the OODA loop. It's an Air Force term, and it stands for Observe, Orient, Decide, and Act. There's a long story behind that name that I won't bore you with on this webinar, but long story short, it was for us a great metaphor on the importance of being nimble and flexible when working with large enterprises to innovate. In terms of who we are, we're very proud of what we've built in just 3.5 years. We are 100 OODAs strong now in terms of employee base distributed across the country. We've raised almost $60 million to date. But importantly, most importantly, is the impact that we're having. So we are managing now our patient growth has been over 400% in just the last 6 months. We've seen a huge acceleration as a result of COVID, and the partners that we now work with generate over $40 billion in net patient revenue a year. And so we're really proud to be working with leaders like CommonSpirit, some of the most sophisticated enterprises in this country. You can see some of those provider partners listed at the bottom of the page. In addition to CommonSpirit, there are medical centers like Tucson Medical Center, community hospitals like Silver Cross, and other large health systems like Mass General Brigham. But also you'll note, interestingly, that we have payer partners on the page too. And this is unique because in healthcare, you often are either a payer solution or a provider solution. And we get the question all the time on, well, are you a payer tool? Are you a provider tool? Who are you? And we think, frankly, that's part of the problem in healthcare. I know what Rich and I both believe is that healthcare is a team sport, and we have to be working together with payer and partners at the table, not just with one side or the other. And we're very committed to that approach as well. We engage with both parties to create collaborative solutions. Just a little bit more on the team, because we're really proud of the leadership team and board that we've assembled. It's a very unique blend of folks very steeped in healthcare. So our board members include Dr. Steve Klasko, the CEO of Jefferson Health. We have Annie Lamont, who's the managing partner at Oak HCFT, which is literally healthcare and fintech investing. And then we have folks like Diego Piacentini, who was the #2 at Amazon and formerly at Apple, who's very intensely committed to a best-in-class consumer experience. And so what we're really proud of is we've created this unique blend of healthcare, fintech, and consumer expertise, and really bringing it to bear on the problem of patient billing. So with that in mind, let me tell you a little bit more about the origin of the partnership. And here's a brief, simplified timeline here. Back in September 2019, CommonSpirit, OODA, and Blue Shield of California at the time got together to discuss what we might do to roll out our solution together in California. Really delighted to have started in Sacramento there. Previous to that, we actually had already rolled out with Blue Cross of Arizona with a pilot in the Chandler, Phoenix market. We quickly discovered that we were successful there, and we'll go into that impact in a little bit. And just a few months later, we were able to expand that rollout more broadly in the Sacramento market. As we demonstrated good results, and in particular, patient impact. In fact, just after the first few months, we saw that 96% of patients felt like this was a better experience. So as we demonstrated that during the late spring, summer of last year, we earned the commitment from CommonSpirit to expand pretty dramatically. And so we are delighted that we are now expanding statewide in California to almost 30 hospitals up and down the state, and that we are continuing to look for expansion in other markets. As we'll go into in a little bit, we'll talk more about our collection performance as well, but we're delighted to be realizing much higher collections than historically through kind of the unique roles that we're getting payer and provider to play here. Rich, anything you'd add in terms of the partnership origins here before I move on?
Yeah, I mean, I think ultimately what is most exciting is the variety of individuals involved in this. And so, this represents, people that are really focused on, the care process and, our physician enterprise. It represents people that are focused on the revenue cycle, our operating leadership, our financial teams. And so, I think anytime that you do these types of multi-stakeholder partnerships, you really need to show value to people across the ecosystem. And, this is, something that we're really working on for multiple reasons: financial, clinical, operational, and for our brand experience. And so ultimately, we've really engaged those types of individuals to help shepherd through this process and figure out a way to, really work together with our payer partners and with OODA.
Yeah. Thank you. And with that in mind, I think it's helpful just to share some of these principles. Like, I remember when we decided to kick this off, it was Paul Markovich, the CEO of Blue Shield of California, who called Lloyd Dean, the CEO of CommonSpirit, and Marvin O'Quinn, the COO, and then Rich. And we sat down together and said, look, we have to work together to create a better patient experience. And that too often we don't treat patients like the members that they deserve. And we really need to create a member experience, that they are part of a system, that there's a relationship here. And that it's impossible to do it if we're doing something on the provider side that's separate from something done on the payer side. We have to do it collaboratively. It was a 30-minute discussion. There was no PowerPoint. There were no business cases or proposals. It was just that commitment to create a member experience and transform that from the current patient fragmentation. That was really what galvanized this partnership. And so when we aligned on that principle and really set that as our key goal, there were then other tenets that came through pretty quickly. So first, like I said, North Star is absolutely the patient experience here. We know that that drives everything. And the good news is that with an improved patient experience comes improved financial performance, stronger loyalty, retention, and of course, collections. So those things are not, you're not trading one off for the other. The second is, communication, and that sounds like a hand-wavy statement. Well, of course, we're going to communicate. But actually, one thing that's been super valuable is we have now regular steering committee meetings between the payer, provider, and us on a regular cadence. It started even as every couple of weeks. It's now evolved to every month or two, where we gather together to share learnings, best practices, discuss themes around patient challenges where we can maybe work on together versus just one side or the other. And I would argue those forums that we put together have been as valuable as the actual technology solutions. Of course, the technology is critical here, but in particular, finding ways to create connections between systems. Like, how do we connect to the CommonSpirit CRM as well as the Blue Shield CRM so that when a patient calls and has a question, we can resolve it on that call, not ping-ponging them back and forth between different systems. So those kinds of tenets, and of course, not least, leadership support throughout to make sure that we're overcoming boulders as we go was essential here.
Yeah, Seth, I just add in, I love how I love the word trust here on the slide, and I think all relationships really begin with great trust between organizations, or they break down when there's no trust, right? And so, the trust between the providers and the payers is key. I mean, that was a historic challenge that I think the industry still has, and we need to think through about how to bridge that type of relationship so that we're working on together on behalf of members and patients. And when they're the same individual, we should be supporting them like they're the same individual, obviously. And then also trust with OODA team, as an outside partner. I think too often in healthcare, organizations paint outside technology companies or services companies as vendors. And I think that just puts it in a different type of light. I mean, I want, partners with expertise that are working on behalf of our team, alongside of our team, and just really want to create that environment that, we're sharing and leveraging off of one another's expertise to superior outcomes for those we serve.
Yeah. I just got to pile on really quickly on that trust point, because there's such a common narrative that we hear all the time. We talk to our payer clients and they say, well, our providers, all they want to do is just bill us for as much as they can, right? And then you go to the providers and they say, well, those payers, they just want to deny all our claims and hold back payment. And of course, these narratives become so calcified and they become, frankly, very restraining. And so with these dialogues, with this space to collaborate, we've been able to break down many of those narratives and discover there actually are win-wins here. Like, it's not just one side at net zero of the other. There is common ground. So with that, Rich, I'm going to go to the next slide to share just a little bit on what you and some of your colleagues have said about the program so far.
Yeah, just here you see a few, I would really say that, our financial partners in the organization, you see some great quotes here from our chief financial officer of our Arizona division, as well as our revenue cycle partners have really worked alongside of us. I mean, that's one of the areas that we really felt was critical to, engender the type of partnership that is necessary, because at the end of the day, these are areas that are typically responsible for, the patient financial component of operations. And so, anytime we work on a partnership at CommonSpirit, we don't do it as a side thing. We don't do it, in a building all by itself, like an innovation building. We do it in the real field with the real people that are accountable for these types of operations and performance. So, as I talk about innovations with others that are coming up in the industry or in schools or other types of things, I think the most important thing you can do is never create an artificial environment. You need to create an environment that is truly real and is testing things out with real doctors, real nurses, real patients, real situations every day. And at the end of the day, if you have your champions that are accountable for those things, speaking up and owning the success, you're in a much better place than you would have been, creating something somewhat in a vacuum. And so, we were really pleased to have this great level of support by our financial leaders, operating leaders, and others.
And it's been also exciting, as Rich knows, to engage with marketing leadership as well and other folks within the CommonSpirit system who have a stake and an interest in engagement, and thinking about, if we're sending a bill to a member, what could we do with that bill to actually make it a rewarding and delightful member experience? And so, and a lot of credit to Rich for helping us engage with those folks. Okay, so what then is the problem that we've looked to solve here together as partners? I don't think the theme around patient billing requires much explanation. If you've been in healthcare and you've consumed healthcare, you know that patient billing is not a great spot in the system. The majority of patients today do not understand the bills they received. I joke that whenever I tell a family member or friend what I do for a living, I immediately hear some complaint about some experience they've had. It's like, well, can you fix this, please? Because this one time I had this, this, and this, right? So the majority of Americans do not understand the bills they receive, right? And only 20%, only 1 in 5 of bills that are sent are delivered electronically in 2021, right? And so not only is it not working, it's also extremely expensive, right? That's not a great combination. And the problem is that it's only getting worse, right? And it's getting worse because patients are the new payer. Once upon a time, patients only owed $5 copays at the point of service. And so for CommonSpirit to collect a $5 copay was not a big deal, right? And generally speaking, copays collected at the point of service are generally frictionless and not problematic and easy to do. We do it all the time, right? But what's happened, of course, is that we've introduced this thing called the high deductible health plan. High deductible health plans are not copays. That often means that a patient might owe $3,000 or $4,000 or $5,000 after a service without any clarity upfront on what they actually would have owed. So suddenly you have patients who have left the building, they are gone, they are done with their hospital care. And then a month to 2 months, maybe 3 months later, they get a bill that they did not expect for $4,000. And it is now the hospital's job to chase that bill and collect, right? And that is a very difficult proposition. They have already consumed the service that they're now expected to pay for, and they often were not expecting to pay that much. And the challenge is that population of folks with high deductibles is only growing. In fact, growing quite a bit, 140% since 2010. And unfortunately, during COVID and all the economic impact there, we're seeing even more folks churn off of richer group plans into more of the individual exchange and high deductible plans. So this problem is only going to get worse, which requires us to work collectively to think about how to address, right? The good news is that we have figured this out in other places, right? If you could take a process as complex as a mortgage and make it possible to get a mortgage approved on your phone with the click of a button, we can certainly do this in healthcare. And our point of view is that healthcare continues to be this straggler that now needs to catch up to every other sector of the economy. The example I often use is that if we were all in a post-COVID world to go out to lunch together, the restaurant does not employ a collection agency behind the kitchen to then chase us for a bill a month after the meal. And of course, that restaurant then doesn't segment its bills and say, well, the winery is going to send you a separate bill for the wine you consumed, and then the produce vendor will send it for the salad, right? And you can chuckle as you think through the possibility of that restaurant experience, but the reality is that is exactly how healthcare is set up today, right? And then imagine if you went to multiple restaurants over the course of the month, all of the paperwork you would get, and that is healthcare. That is our system today. Right. And so if we can figure out how to get every other sector of our economy to evolve, not least the mortgage industry, we can certainly do this here. Right. Now, this for us is the core problem that we were looking to solve when we talk about the patient experience in healthcare. Right. When a patient goes to CommonSpirit and presents for an episode of care or a care event, right, this is the one bill that patient might receive. Right. And of course, this is a function of the fact that there are many affiliated docs, non-contracted docs, foundation groups, then you have anesthesiologists, emergency departments, there's an ecosystem. And then, by the way, this is not just CommonSpirit, this is really any health system in the country. And so in a moment when a patient is most vulnerable, in recovery, in need of simplicity and support, we give them this, right? We give them this experience. And layered on top of that, they get all of these EOBs, these things called explanation of benefits, those papers that say this is not a bill. Every single one of these bills comes with a corresponding this is not a bill. And about a third of the time, those don't even match the bills. In our patient testing and panels, when we ask patients about this experience, they tell us very clearly that if my payer and provider can't spend the time to get the numbers to match, I'm not going to spend the time to pay it. And frankly, it's a pretty reasonable point. We are so eager for patient engagement. We so want patients to take responsibility for their care, to pay their bills. But if we're giving them this experience, frankly, how much should we really be expecting? So why do we focus here? Because we know that if we clean up this process, we're not going to just get happier patients or faster payments. It's really going to impact the loyalty and retention to the system. And this comes back to the points that Rich were making earlier, is that this is about treating a patient like a member. And what happens when we do that, right? Right now, half of patients say the worst part of their experience is billing, right? So when they think about switching and not being loyal and finding other places to give their membership, the majority say they would do so because of payment, right? In fact, already today, 1 out of 5 patients have left a provider because of a poor digital experience. Right? Think about that time you went to a restaurant and the food was great, but the service was so lousy, you said, I'm never going to go back there. We've all had that experience. And that's increasingly what's happening in healthcare. And that's only getting more accelerated because in a world of virtual care, which is now the world we're living in, competition is national now. CommonSpirit no longer just competes with the provider down the road. It's any player who can offer virtual care nationally. So the bar is now higher. Right? So we're going to take a moment. It's a lot of us talking, a lot of passion here. Chris, I'm going to turn it over to you to manage the poll. We'll take a quick audience check.
Thank you, Seth. Great content so far. Let me launch that poll. Here are 3 questions. We'd love your thoughts on these 3 questions. And while you're taking a moment to respond, let me remind you that we're also taking questions at the end of the presentation. So please submit those using the questions pane in your Zoom controls. So question number 1, how satisfied are you with your current patient member billing experience? Options between very unsatisfied and very satisfied. Question 2, how significant is the administrative friction that you experience between payers and providers. Again, a scale between very insignificant and very significant. And then question 3, what is the primary problem you see with patient payments today? With options: payer disconnect, plan design, digital tools, affordability solutions, not sure. We'll give you a few more minutes, a few more moments to answer. Another 5 seconds, and then we'll end and show our results. Okay, thank you for participating in that poll. I'll go ahead and share the results here. Here are the answers, Seth and Rich. How satisfied are you with your current patient member billing experience? 27% said very unsatisfied, 35% said somewhat unsatisfied, 24 neutral, 14 somewhat satisfied, 0 are very satisfied. Interesting. I'll read these results quickly and then let you react to all of them at once. Question 2, we asked how significant is the administrative friction that you experience between payers and providers? 11% said very insignificant, 16% somewhat insignificant, 8% neutral, 54% said somewhat significant, 11 said very significant. And then the last question, what is the primary problem you see with patient payments today? The majority said payer disconnect, 32%, then 24% plan design, 16% digital tools, 14% affordability solutions. Seth, Rich, what do you think about that?
I mean, to me, it emphasizes this hypothesis that we're trying to work on, which is, there are multiple parties that are working on behalf of the patient. The providers were caring for the patient, their family, returning them to wellness. The payers, they've been engaged as member. The patient has selected them to, safeguard the financial, part of their care. These are big and large, complex organizations that view things in different lights and, sometimes use different terminology for the same types of things because one is more medical in nature, in its upbringings and the other is more administrative in nature in its upbringing. So, this is really about, we need to find a common language and we need to center on common tools that align around, what's best for the patient and the member. This is, I think it is a journey, what we're trying to undertake here together with OODA, because there are, changes that need to be made. But ultimately, this friction cannot be solved by a provider or a payer independently. There has to be a joint commitment to working together, and then someone in the middle, like an OODA, that can help enable great technology or great user experience, or connecting and removing friction points that they can view as a almost a bystander, that are unnecessary steps along the way that maybe automation could solve for both parties. And so that's part of how I'm viewing some of these results.
Yeah, I completely agree. Oh, sorry, Chris, go ahead. You can say something.
I was acknowledging, thank you, Rich, for that perspective. Go ahead, Seth.
Yeah, I mean, just as Rich noted, I think it is a helpful, I like your point, Rich, a validation of our hypothesis, which is that the payer disconnect is playing a big role and that folks see that. And the fact that, we really need to be working together on behalf of patients, yet this friction and the disconnect is what's driving so much of the fragmentation of the experience, I think was, really interesting here. And it's also, it's unfortunate, frankly, that so many of the folks, and now it might be self-selection, you're going to join a webinar to learn about this if this is a problem in the first place. But knowing that this is such a critical aspect of the patient experience that so many of us feel like no one is very satisfied on this call with how it's working. And that's just, for me, creates more urgency to fix it. So thank you for your input here and appreciate that. Okay. So the easiest thing in the world to do is to talk about all the problems in healthcare. Let's start to get into the solutions. We, I think, as you're hearing, have taken a novel approach to patient billing. And for us, what we believe is that you have to have an integration with payers in order to truly transform the billing experience. So to say that differently, we do not think that a provider alone should or can fully solve this problem, right? Every other merchant in our economy, any other purveyor of goods and services, does not also need to employ a financial services arm to chase the consumers of their goods and services. We do not think providers should be any different. And so for us, what we believe is that we are leveraging a very unique payer intelligence layer to truly create the ideal experience. So what does that mean? Bringing resources to bear from the payer so that we can consolidate bills with the payer's support. We can show where they are in the deductible. We can explain their plan design in richer detail. We can show that they have an HSA balance available to them that they may not have been aware of or forgot about when they showed up at a provider. We also believe that you have to be table stakes with other consumer billing features. So it needs to be human-centric and beautiful design. And that's why we're very proud to have brought folks from the consumer world, not necessarily the healthcare world, to design our billing experience. It needs to be high tech and high touch. We see too often vendors tend to gravitate to one side of that spectrum. It's like, oh, we're going to have this really robust call service center, or we're going to be digital only. We really think both are essential because in healthcare, you got to meet patients where they are. And there's going to be some millennials, like Rich, who are all about texting and getting things on apps. And you're going to have others who really need to engage, with paper statements or talking to someone live. And we think both are essential. Payment methods and being flexible there are critical. We accept everything under the sun, Apple Pay, Google Pay, HSA, HRA, and we remind people that they have those different options. And importantly, we set up payment plans in the app. Too often, you have to call the provider to seek financial assistance. You sometimes need to fill out a paper application form. Here, with one click in the app, you can set up a 9-month, 10-month payment plan to ensure that the bill kind of matches your affordability needs. And importantly, we personalize it too. We know that a bill is a communication channel. So we can remind you about aftercare resources from the payer, resources from the provider, rather than getting these things in disparate communications. And lastly, yeah, go ahead, Rick.
I was just going to jump in for one sec, Seth. I'll just go back to this high tech and high touch comment. And I think this really speaks to the genesis of health equity, which is really critical to many non-for-profit organizations, many organizations, every organization across this country, which is like, we can't be creating a digital divide while we're streamlining these types of things. And so, we recognize ultimately there's patients with barriers to care. Could be language barriers, could be access barriers, could be financial barriers or others. And so, we need to be designing these things in a way that can really solve for everyone and the issues that are independent. There are some people that definitely, enjoy the chance to, quickly tap a few things on their app and get things done, but that's not everybody. And that's not, maybe some of the people that have the greatest challenges in our country. I think over time, things like this, when, they are reaching out to those people in need, we can think about, access to all kinds of different social services and other types of platforms that can help people. So to me, this is the beginning of a journey of understanding a person as who they are and what their needs are. At the end of the day, hopefully we can develop and deliver upon more of their individual needs as we're hoping to return them to overall wellness. Yeah,
that's great. Thank you. And yeah, please jump in anywhere here. And, the last thing I wanted to mention was, and I think this is really important, is we are agnostic to EHRs. We sit outside the EHR. We are able to leverage resources from the payer as well as connect to the provider in really innovative ways so that we are not dependent on or creating confusion with EMR systems. And I think very frequently we talk to health systems and we hear, well, our physician enterprise is on this instance with this EMR vendor, and then the hospitals are on this EMR vendor. And that's unfortunately the barrier with us creating that one bill experience. Frankly, those are the areas where we shine. We love those situations, albeit they are messy, because we are able to uniquely bring resources to bear to create consistency and protect the patient from the complexity of your system setup. So this is just a brief glimpse. If we had a little bit more time, would love to show you what it looks like, do a demo live here. But for now, we'll give you just a brief glimpse of the visual. I think a couple things to point out that we're very proud of. You see your bill on that left side, you see that that's your balance that you owe. And right there, we tell you you've met your deductible, but you still owe coinsurance until you're out-of-pocket max. And then we're reminding you that you have an HSA and you have money in it that you can use for this event. That's so powerful for us because that information is usually not available to the patient when they need it. They have to go search on some other set of resources, go to the payer. They often will call you and ask you, well, haven't I met my deductible? And you as the provider are like, well, I don't know. I don't manage your deductible. I didn't set your plan design. You should go ask your payer. Here is that single source of truth, serving up that information just as the patient needs it. That second screenshot is a brief example of the payment plans that we're so proud of. We make them really simple to set up. They're not behind a bunch of gates. You don't need to submit a paper application. You can set your preferred term. And again, helping members, realize their affordability goals have been super important to CommonSpirit, and of course, equally important to us. And on this last screen here, we talk a little bit about personalizing the message. A bill is a communication channel. It is your opportunity to talk to your patient when they are thinking about the care they just received. So rather than just treat that patient as a receivable to be chased and a dollar to be collected, what if we were to engage that patient with relevant content to help them understand the resources to bear, right? So again, if you have aftercare resources, nurse coaching, advocacy, if there's a follow-up reminder that you want to include, why not make it part of that single bill experience? Why send that as some separate communication? We can create that more holistic experience here, right? So how does it work? Again, we're going to give the high-level webinar version of this now, but of course, we're always eager to go deeper into this if there's questions. The goal here and how it works is to protect the patient from the complexity of the system. Rather than putting the patient right in the middle of it and having the patient figure out how to deal with it all, we protect the patient from the complexity of the system. So what that means is, in the case of CommonSpirit, right, and here's a good example, in Arizona, they have Mercy Gilbert, Chandler Regional, these are two of their hospital sites, and then they have a partner in Vision Healthcare that staffs their emergency departments in anesthesiology. Those would all bill separately in a typical instance, right? You get a separate bill from each of them, and of course, a separate EOB. In this case, we are the billing vendor. We are the solution that sends out that bill. And what we do is consolidate and simplify that experience. We bring the payer EOB in, we bring the different bills from these three providers in, and then we send out a single statement like you just saw on the prior page, right? And so it's creating those integrations on the back end so that the only thing that patient sees is that credit card statement. Right? So what we're excited about too is there's a whole extension here on what we've done with our payer partners. Rich mentioned that we're working with Blue Cross of Arizona, Blue Shield of California, and there's a whole other channel now available to us through our payer partners to enhance the experience. So patients, of course, do not only interact with their provider, they're going onto their payer websites to check for claim status and claims history. So why don't we use those assets to reinforce the same messaging so that they can go onto their payer website and see that they do owe a bill back to CommonSpirit, that their balance is due. We're discovering payment synergies as well. It turns out, not surprisingly, that Blue Shield and Blue Cross send bills out all the time. They send premium bills out to their individually insured members. They have payment credentials established. They have credit cards on file for those members. So rather than send out a premium bill and a cost share bill totally separate, what if we create synergy there and say, oh, Rich, I see that you've set up your premium bill with this credit card, you want to apply it to your CommonSpirit bill, right? Cost estimation. We know this is top of mind for folks given the recent legislation. Everyone's thinking about cost estimation. So how do we ensure that the patient isn't toggling back and forth between a payer estimation tool and a provider estimation tool? Payers own many of these tools. They own the fee schedules. They can surface cost estimation tools that we can bring into the experience. And of course, the EOB. We believe very strongly in consolidating and merging that EOB with the bill so that the member is receiving a single point of view, not managing through paperwork. So these are just a couple examples of how the payer serves as kind of reinforcement of an enhancement to the experience we've set up on the provider side. And of course, with this experience comes results. And we are so proud that at CommonSpirit, we've been able to achieve significantly higher collections performance than the status quo. And so the way that we measure it is we look at industry benchmark as well as the historical collections rates of our provider partners like CommonSpirit. And we say, okay, if you've achieved X% over time, how do we ensure that we are overachieving that as we go, right? And so the way we determine performance is we look at from a moment a bill is due, right? That first bill goes out over time. What is our propensity to collect? And so 30 days out, 60 days out, 90 days since that bill went out, we measure how effectively are we collecting. And what we're finding is that we're achieving about 20% lift pretty consistently over that historical benchmark. And so for us, this is what's so energizing is that through creating a better member experience, we're able to realize higher collections. It's through nothing punitive. There's no aggressive, I mean, CommonSpirit's very, as Rich knows, they set a very high bar when it comes to maintaining that experience. And so it's through that experience we create this performance. It's not through anything punitive. Great. Well, with that, Rich, I'll turn it to you for the next page to share more on the experience.
Yeah, so many conversations and looking at so many of the questions and answers, which I know we'll get to on the financial side of this. And I just like everyone just to pause for a second. Ultimately, what we're doing here is part of a human journey. It's part of a time where people are at their most vulnerable. They're in pain, and we're seeking to help heal them and to return them to wellness. And so I don't, from my experience working early on, I don't necessarily view these as distinct parts of a charism. I understand that the financial part of the journey is part of overall healing. It's part of your mental health. Certainly as you recover and are trying to go back to your normalcy of life. And so we took a chance to video one of our patients who was willing to share their story about their journey. And so and you can see how creating this partnership, this tribe partnership could add value to people and help them heal quicker and regain some of the joy in life that could be strained in a negative financial experience. And so we wanted to share that with the audience today.
Yeah, great. Thank you. I'm going to go ahead and share my screen here. And as I do that, let me just optimize for video. And I do that, as a note says here, do listen to the end. It's about 3 minutes in total, so not very long, but the end part I think is the most rewarding.
Probably my 12 years with him have been a little bit of a struggle. When Kent and I met, I was this young, healthy, vibrant human. Not that I'm not that anymore, but it's definitely taken a long road to get back to myself. I mean, a long road. Kent signed up for something he didn't know he was signing up for.
Let's face it, nobody wants to be sick, nobody wants to get hurt, but it happens. So if you can make that process cleaner and easier, all the better for everybody. Healthcare is expensive, so we've paid a lot of money over the years, and I like to make sure that when we're paying something, we should be. I still want to have that information at my fingertips because that's my nature. I'm going to question it. I want to see before I feel comfortable. Healthcare is a big, big pie, and there's a lot of different pieces to it. But for patients specifically, I feel like there's a lot of patients that don't understand the process. They will just carte blanche pay something. They just assume everyone's on the up and up, everything was done correctly, and a lot of times it isn't. So to be able to build that trust up with patients, with everybody involved, I think gets people closer to understanding the process and ultimately could lead to a cleaner process when there's a lot of moving parts to it.
Going through all this, I never thought I was going to get to have a baby, ever. I'm like, am I ever going to have the opportunity? My body is a mess. I can't seem to get it under control. It's one thing after the other. Sorry, I'm going to get emotional. I called my husband and I just yelled it on the phone, and he was like shocked on the phone because normally normal people would wait and be like, oh my gosh, guess what? But not me. I'm not normal. So I just told him over the phone. I was so excited. I've never been more excited for anything in my life, ever. I had a pretty amazing pregnancy. And then when she was born and we got to hold her and I got to see her, it's like, this is why I've endured all of this. When I first received my billing for Blair's birth, to be quite honest, I was confused. I even had my husband look, I'm like, why am I getting a bill from Blue Cross Blue Shield? And then once I did and read a little more closely, I realized that that was my bill. And then it had been simplified. So that was kind of an aha moment of, oh. And at the time, I don't think I was aware that OODA Health and Dignity were partnered with Blue Cross Blue Shield, so I didn't understand the process. I just had received this bill and thought, this is way too good to be true. I'm not paying this. I don't understand it. OODA Health just makes it easy. It's all in one place. It takes out the guessing. It takes out the legwork. There's so much legwork that has to go into properly paying your medical bills if you don't want to overpay. I would use OODA Health over anything. If I was searching for a provider, OODA Health, if I saw that name, I would just know that would be a huge factor in deciding who I would go with, what provider I would choose, because it's a no-brainer. It really is. It's simple and easy. It's all consolidated into one happy little piece of paper.
Great. So thank you for taking a moment to hear about that patient experience. Ultimately, it's the patients that we think are the most powerful voice here. Very briefly, just on other key highlights of the experience with CommonSpirit, we are collecting more quickly. That's something we've been very proud of. We find that patients often wait to pay until they can reconcile the EOB, but now, given our ability to streamline that, we've been able to see payments come in faster. As we mentioned before, we're seeing a 20% lift in yield over historical baselines. Importantly, that 96% patient satisfaction, which, I mean, again, I just think about that video and I've seen it so many times now, but that statistic just does not fully represent the experience that a patient has when you can take the stress out of that part of the experience, and to see what that patient has gone through and the impact we can have. I still get worked up. And then also really delighted to see the engagement that we get. So in other words, the way we define engagement is for all the messaging that we send out, whether it's via text or online or by phone, even via the mail, how frequently will a member respond to us? Will they come onto our site? Will they pay, make savings? Now, a lot of billing vendors don't measure engagement, but of course, we're not just another billing vendor. We think engagement's really critical. And with engagement, you can drive a whole set of messaging and a different experience. And so we're delighted to see that just about everybody responds to us when we send them a bill, because it's a bill and we can do so much with that. So with that, I'm going to turn it to Rich to wrap us up here, and we'll take questions, but just on kind of where we're going and our vision for the future.
Yeah, I mean, I would just say, you know, at the end of the day, you know, we as providers view this part of the journey as part of our brand. The engagement numbers that Seth talked about are really interesting when you think about, you know, other types of things that, you know, patients may need in their lives. It's you know, as we try to stress prevention and, you know, healthy living, and we try to, you know, work on barriers to care that, you know, may arise at unique times during patients' life, and like anything else, when addressed earlier, could you know, result in an opportunity to serve them, you know, better. And so, you know, this is one really important part of the journey. I think it, you know, has multiple different, you know, value chains to us. Certainly the financial one that Seth said, but also really, you know, how we might grow and how we represent ourselves to the community. And so we've been pleased to been working on this project together with OODA, with our payer partners. And, you know, I think it's the beginning of a journey, but, you know, we're excited to see the early results, and the steps, you know, along the way have been really positive.
Yeah, thank you. And as Rich just said, it is the beginning of the journey. And, you know, for those listening in, you know, we are really looking for partners, not just customers. There's a lot that we have ambitions to do, a lot to figure out, and we're really hopeful we can find other partners to support that. And we're excited for that. So with that, Chris, I hope we kept time okay for you here. I'll turn it back to you to kind of manage any questions that have come through.
You're on the spot with timing. We've got about 12 minutes before we wrap up, and lots of questions here. So let me start with a few at the top here. How does OODA manage denials? What is the incentive for payers? Who owns the patient dues eventually? This is from Akash.
Okay, so wait, let's take those one by one. So how does OODA manage denials? I'm happy to take that one. Although Rich, you of course can chime in on any of these. We manage denials just as you would expect from any you know, kind of high quality patient billing company. We do not take punitive action. We follow the policies of the provider. If after a certain period of time, the provider chooses to have that come back to them, and then they use, you know, some other tactic, you know, maybe they have a delinquency vendor that they work with or some sort of bad debt arrangement, we adhere to those arrangements, but we personally, do our best to engage that patient. And if we're unable to, which often sometimes happens, then we ask the provider for guidance on what they want to do next. What were the other parts? Sorry, what were the other parts of the question? Yeah.
What is the incentive for payers?
Okay, incentive for payers. That's a great one. So payers actually have, believe it or not, a real incentive to participate. And Rich has been in these conversations. First, I think they recognize this is not a provider problem. This is a system problem, right? When a patient does not pay their bill, and if CommonSpirit has to write off the bad debt, that is an expense that CommonSpirit absorbs and becomes part of the rates that they have to charge in the market, right? So if we work together to remove bad debt from the system, then the system rates can be moderate, right? Number one. Number two, when a patient has a bad experience with the bill and they go to their provider and say, I don't understand my bill, many providers will say, well, it's your plan design, it's your coverage. And so it's not that the payers are immune to these things. In fact, we've heard very clearly the single biggest detractor from member NPS for a plan is billing. And so it is a system problem, and the payers have a stake in making it better. And if they help make it better, they improve their provider relationships and they improve their member relationships.
Rich, any comment on those two questions? No, I mean, I do think, increasingly, if you're a consumer, you're viewing this as a problem you don't want to solve. So you went to a provider, you've engaged with your health plan, and then here you have all these stacks of paper or, processes and issues, and people are busy in their lives. They're doing their own jobs, they're taking care of their own kids, they're trying to pursue their own hobbies and passions, and none of those exist rectifying a bill between a provider and a payer. And so, I think ultimately, whether you are a provider or a payer, and I think in this process working together, your ability as those organizations to help solve this on behalf of the patient or member is really important and part of the overall experience that you're trying to deliver to the market. And so I think those incentives are increasingly becoming strong.
Thanks, Rich. Third question from that same person that ties to a couple other questions is related to risk. Who owns the patient collections risk eventually?
Yeah, take that. So the provider maintains the collection risk as today. So we operate as a contingency fee or administrator of the collections work. There are cases, with that said, where payer partners choose to offer some sort of guarantee or cash advance to provider partners on top of our service. That is their choice. That's happened in some examples where payers are eager to support their providers, and we're delighted to be a platform for that. So that's kind of that optional layer that we sometimes see.
Thank you, Seth. Next question from David. How does OODA pull in HSA balance? Many employers use different HSA platforms separate from the payer.
Yep. So that is true. Great point. We, though, find that payers generally have an HSA vendor that they default to as, for the majority of their book of business, either for smaller group business or individuals, they have that default vendor. So we plug that in right away. For employers who might have different arrangements, the good news is that, from our experience, there are only a handful of large HSA players, and we're integrated with most of them at this point. So if an employer is working with someone different, we identify that on an eligibility file, we're able to show that balance as long as we have that vendor relationship. And like I said, we work with most of the big ones, so we get pretty good coverage there.
Excellent. Thank you, Seth. How does OODA catch the errors of missed payment in EOBs and or provider bills? Is there a manual review of those to assure accuracy?
We do employ manual review. We absolutely do some audit work there. But the other thing, we have just some safeguards, even from a technology perspective, that are pretty unique. And I don't want to bore our audience here with too much technicality, but I'll give just one example. We get a copy of the 835, which is the payment remittance from the plan, and we match it against the 837 that the provider would send. So these are EDI transactions that go back and forth between payers and providers. We have access to both. And so we use that information to match and ensure consistency. And that happens with every single bill that we send out. So again, another example of where that payer provider connectivity really helps us ensure quality.
Thank you, Seth. Another question, what is experience including a payer that doesn't have OODA Pay?
Yeah. Wait, the experience for the payer?
Yeah, what is the experience like, including a payer that doesn't have OODA Pay?
I'm not sure I understand that question. The experience, Rich, do you understand that one? Maybe you can take it.
I'm trying to read that one. I don't see it exactly, but I don't understand it as.
I think it's, what's the experience like for a patient if you have some of the information, but not all the information for that patient?
Oh, I see. Okay. Yeah, so we recognize that you can't have integrations with every single payer that a provider works with. We service all patients for a provider, regardless of payer connection. And then we leverage third-party data or payer connections where we have it to make enhancements as we go.
Yeah,
we believe very strongly that all patients deserve. Yeah, go ahead. Yeah,
I was going to say, well, I mean, one of the things we're working on. So let's say that you go to the hospital and you have a procedure, and the hospital does some of the work. Physicians may come in, such as a emergency room physician group or an anesthesiology group or other types of groups. And, one of the big, I think, dissatisfiers for people is they may have 3 or 4 or 5 different bills, and they think they may have paid the hospital portion, but not the physician person, or vice versa. And so part of our work is trying to figure out, how do you bring all of these associated parties together into one bill so that the patient can fully understand what they are accountable for, in one uniform way instead of others. So we're working to pull those types of relationships together to be able to offer that. That would be really something new and fundamentally new in the marketplace that we're building towards. But today, not in every case does that representative physician group and hospital and payer all align on the same sort of member, but that is part of the goal.
Totally.
Thank you, Rich. Thanks,
Very
Seth.
well. Yeah.
Does OODA also offer a user interface for the payer? Wondering how you get rid of EOBs and match patient liability estimates information.
Yeah, so we work with the payers to drive consolidation here and ensure whatever information they're sending out on the EOBs can be part of the patient bill. In some cases, the payers may not yet be ready, and that's okay. At a minimum, we make sure that the EOB matches that patient bill exactly. That already is a huge improvement. So we get the copies of every EOB that go out from the payer, and we ensure that you can put them right next to each other and they line up, every line item, every number matches the same. And I think that's the minimum step forward we would take. And of course, over time, look to merge them totally.
Also related to consolidation, how does OODA know when to trigger the consolidated bill communication to the patient? Some providers may take forever to file their claims. It seems counterproductive to wait so long.
That's a great point. And we don't necessarily wait. So obviously, if we see an anesthesiologist claim come in, we might wait a couple of days to see. There's probably something else that's coming through. So we might hold that for a day or two just to try to create that consolidation. But there's no need to wait. I mean, again, think about your credit card experience. That's the experience we create. You have a rolling statement. And so if Rich goes to his primary care doc and then a couple of days later gets a lab test or whatever, that becomes part of that single statement, that single experience. And so that's the model that we employ. It's fine if something comes in. I mean, we go to restaurants all the time at different times. We don't wait to get that single bill, but there's a cadence of a statement, and that's the model we follow.
Thank you, Seth.
Yeah,
maybe last question before we wrap. You mentioned matching 837s with 835s. Does that mean the process for patient billing kicks off after the 835 comes in and not on the date of service? Thanks.
Yes, it's very important. We consider ourselves a customer of the adjudication process. We don't want to generate a bill for a patient before we know we have validated what's owed. And so we do wait that day or two for that claim to be processed. Of course, there's a lot of work that's done at pre-service and point of service to engage with the patient on billing. That's work we're really excited to share more about soon. We're actively building a roadmap in that direction. But for now, we're really talking about that post-encounter billing experience. And we do wait to ensure that we know exactly how much to bill that patient after the claim's been adjudicated.
Thank you, Seth. Wonderful. We've actually reached almost the top of the hour. We're going to wrap up here. Thank you, Rich and Seth, for an engaging presentation, also for dedicating yourselves to this great work. Thank you also to all those who joined us today. As a reminder, today's session has been recorded, and within 48 hours, you'll receive an email with links to the on-demand video, transcripts, and the slides. And when you close out of this webinar today, you will be redirected to a short survey. Please take a few minutes to give us your quick feedback so we can keep improving our webinars. And with that, thank you again for joining. Have a great day. This webinar has now concluded.
Thank you.
Thank you.